Good afternoon, everybody. Can you guys hear me? Okay, I have one yes, but I know there's quite a few of you on the line, so I just want to make sure everybody can hear me. Hi, Julie. Hi, Robin. Hi, Scott. Okay, great. You guys are able to hear me. Wonderful. Okay, well, we're back at it again for one more bonus lesson in March. Before we officially kick off our third cohort in April. So, I know we've had to take a little bit of a break, but trust me, I really needed that break because it was a long 6 months of helping you guys prepare. But I am so happy. We've had 6 people pass from cohort 2 so far, and we still have quite a few more who are planning on taking the test very soon. So it's really exciting just to hear from you guys and kind of learn your stories and your journeys to certification. So today, before we get started with our bonus lesson, I just wanted to give a huge shout out to one of our international members, Mr. Abdul Rahim Al-Khamis, MPH CIC. He passed his certification, and he was actually joining us from Saudi Arabia in all of our lessons. So he was listening to this webinar at 9 p.m. his time to prepare for his certification. So I just think it's really amazing just to see how much effort, how much hard work and dedication you're all willing to put in to make sure that you are advancing professionally. It just makes me so proud and so happy for all of you that you're following your dreams and pursuing this certification. So thank you so much for for your support, and I hope that you enjoyed today's lesson. So today our presentation is going to be given by Dr. Luz Nieves. She's an infection prevention specialist for Advent Health Apopka and Winter Garden. She has been working in infection prevention since 1991 and started her career in Puerto Rico. She has a PhD in public health with a concentration in epidemiology, a master's degree in public health with a concentration in epidemiology, and her bachelor's degree in nursing sciences. Dr. Nieves is an adjunct faculty member for the Ana Jimenez University since 2009. She's part of the Healthcare Administration and Nursing faculty. She dictates the public health, epidemiology, and research courses for the graduate program. Dr. Nieves has a vast experience in the operating room as a former perioperative nurse and former chair for education for AORN in Puerto Rico. Her previous clinical experience includes emergency department, intensive care unit, operating room, and SPD. She has been an invited lecturer for multinational companies like Johnson & Johnson, Upjohn, 3M, Convatec, and CEUs, and a CEU provider for the University of Puerto Rico and the Puerto Rico Nursing Association. Before she came to Florida, Dr. Nieves was a clinical scientist for Johnson & Johnson Medical for Puerto Rico and the Caribbean. Dr. Nieves has been an APIC member since 1992. Wow, and is the chair of education for the APIC chapter here in Central Florida. So I know that was quite an introduction, but without further ado, Dr. Nieves, if you would like to take over, we would greatly appreciate it.
Thank
Get started.
Absolutely. Thank you, Luz. I am very glad to be, the presenter today. And I know that after that presentation, people are guessing my age. Yes, I started infection prevention when I was 14 years old. Yes, I've been doing infection prevention for quite a bit of time right now. Okay, so let's go and talk about infection prevention practices for the ambulatory surgery center. It's very interesting because one day a person approached me and asked me, "Oh, yeah, you guys have an ambulatory surgery center. So do you guys follow the same precautions like an OR?" And I was thinking about it. I said, well, we have the same patients in the OR, regular OR, and also we have the same patients in the ambulatory surgery center. Yes, we follow the same precautions in both sides, exactly the same. There is no difference in between. So Going to the conference objectives we have at the end of the conference, the participants will be able to outline the infection prevention best practices following the ambulatory surgery center. You are going to demonstrate the basic knowledge of cleaning, disinfection, and sterilization of reusable medical devices. You are going to describe the Spaulding Classification system and also identify the steps to follow during the reprocessing of medical devices. I know that, OR is a whole new world, maybe for some of you. OR is a world itself between, in a hospital or in an ambulatory surgery center. Some IPs are kind of afraid to go in the OR because it's new for them or they don't know, what to do. I am trying to condense most of the information that you need to survive. But we have a lot of information regarding OR. And the best thing that I can tell you is to go to the OR, know to your OR staff, and also to if you have an ambulatory surgery center, go and visit them, and meet the staff, meet the doctors, the surgeons, and the physiologists, and everyone there, and let them know that you are the IP, you are the infection prevention, you are the expert. Okay, so in the United States, approximately 46 million surgical procedures are done, and these are invasive, or some ones are more invasive than others. And this includes approximately 5 million gastrointestinal endoscopies and are performed each year. According to the literature, approximately 50% of the surgeries are done in the ambulatory setting. The majority of the surgeries on the eye, ear, nose, mouth, pharynx, and skin were performed in an outpatient setting, meaning that when you see, ambulatory surgery, meaning surgeries that are done in patients that are ambulating, first of all, the patients that are going to return home, the same day. But as a difference with the regular, OR, the majority of obstetrical, respiratory, and cardiovascular surgeries were performed in the inpatient setting. Each procedure involves contact by a medical device or surgical instrument with patients, sterile tissue, or mucous membrane. So a major risk for all such procedures is the introduction of pathogens that can lead to infection. Ambulatory surgery centers are defined as facilities where surgeries that do not require hospital admission are performed. Patient is what we call well baby. Patients are fine. Patient doesn't have probability of complications is very slim to none. However, patients, any surgery, any patient that goes, underwent surgery or have anesthesia, if the first time or not, the patient can have complications. But this kind of surgery that is done in a surgery center are, the period of time that is done is very short. They don't have patients 4 hours, 5 hours, in surgery, because that patient is going to require recovery for a long time. So the ambulatory surgery centers provide cost-effective services and a convenient environment that is less stressful than what many hospitals can offer. And the setting and logistics are slightly different, but the infection control practices, as I said, are exactly the same. So first of all, first thing first, hand hygiene. The aim of the surgical hand antisepsis is the reduction of resident microorganisms and elimination of transient microorganisms from the surgical team's hands for the duration of an operation. This what you are seeing in the picture is a normal, hand washing station. It's not as big as the one that they have in the OR, but have all the components that they need to have, the procedure done, which is the hand hygiene. The doctors do the 10 minutes, scrubbing first thing in the morning, and then they use other alternatives, and it's called the Sterilium. I am going to present that in a little bit. In infection prevention best practices, we use proven guidelines to prevent infection after surgery. We use hand hygiene, contact precautions, as well as cleaning and disinfecting patient care equipment and the patient environment are essential strategies for preventing the spread of healthcare-associated infections. So,
we're getting a lot of background noise right now. Does anybody not have their line muted? Because we're hearing a lot of talking. Okay, Luz?
Can I continue? Uh-huh.
Yes. Okay. Thank you so much, whoever fixed their phone. Yeah, go ahead, Luz.
Okay. So hand hygiene prior to surgery, as I said before, the first hand hygiene scrub session is 10 minutes for the surgeons and the technicians or the nurses that are going to be in the case. And then they do hand hygiene in between cases. For the hand hygiene in between cases, they use, when we use a product, what is called a Sterilization, and it's a waterless, brushless surgical scrub that is synthetically reduce the number of microorganisms on the hands and the forehands. It's very fast acting, it's dermatologically tested and gentle on the skin. It's non-sticky. Surgeons doesn't like any sticky on their hands. And also, but it's 80% alcohol. It's a 80% alcohol hand rub, and it's flammable. Okay, so we need to use it with precaution. In the infection prevention best practices, this is the room. In ambulatory surgery centers, it's similar like an OR. The only thing is that they have, the pre-op and the post-op is exactly the same room. In the pre-op, the patient is received, the patient is prepared, is visited by the nurse, they start an IV line, the anesthesiologist is coming, see the patient, do the evaluation, the surgeon is coming also, and present to the patient, explain all the process. Once the patient is ready and have the green light, then the patient is going to surgery. When the patient returns, the patient doesn't return to an anesthesia unit. The patient is returning to the same room, but it's going to have all the cardiovascular measures, and it's going to have all the, all the equipment in order to do a good recovery time for that patient. So best practices are exactly the same. Healthcare personnel do not have artificial fingernails, soap dispensers are accessible, paper towels are available, and also the healthcare personnel use hospital-grade waterless hand hygiene agents when appropriate, and the staff can explain or is observed compliant with the hand hygiene policy. The staff don and remove gloves at appropriate opportunities, and lotions are used appropriately in clinical areas. Exactly the same practice that we do, in any clinical setting. In the workstations and general areas, always look for the following. The floors and walls are clean, the furniture is clean and in very good condition, appropriate EPA registered hospital-grade surface, disinfectant is used to wipe down the surfaces. Very, very important, staff food and drinks are placed in appropriate areas and not in patient care areas. The ceiling vents are clean and free of dust. The ceiling tiles are not stained, and the point of care devices are clean according to policy. These are general practices that we use everywhere. It doesn't matter if in the OR or in the ambulatory surgery center. This is one of the pictures of the area. The patient is received here, and then once the patient is ready, go to the OR suite. The procedure is done, then the patient returns. And then if you can see, this is one of the areas that they have all the equipment that they either sterilize or comes from, the companies. And also this is an example of a medication card or supply card that they have. It's completely closed and everything is closed. We have a place for everything and everything in place. So the storage of supplies is very important for infection prevention because we have clean and sterile supplies that cannot be contaminated by any means. So clean and sterile supplies and equipment are stored appropriately. The items stored at least 12 to 18 inches from a sink, or there is a protective barrier splash guard to prevent splash contamination, and there's no storage under any sink. The supplies are stored on shelves and off floors. The supplies are within expiration date. And when I say event related, is that every facility have, we follow AORN, the American Association of Operating Room Nurses, and also the AAMI standards. If you have a supply that went through the process of sterilization, in the past we used to say, well, if the package that the item was safe, it's paper, it's going to last 30 days. If what other kind of material is gonna last, another amount of days. But now we have a process that is called event related. And event related is if you open it, it's gonna be if you open and don't use it, well, it's lost sterility. So you have to, if the item can be sterilized again, it's gonna have to be sterilized. If the item was a disposable item, you need to discard it. Sometimes items doesn't have expiration, meaning that if you open, if you have to use it, if you don't use it, you have to discard it. So the items are labeled single use only, are not to be reused, and no original cardboard boxes or shipping boxes are allowed in any clinical area. Remember that cardboard boxes are harbor of cockroaches and other critters that can, go into the area, and it can, it can pose a very big problem for the clinical area, especially in an OR. Okay, so these are pictures of storage of supplies. You can see in the second picture that you see a red line. You cannot have anything above that red line, and also at the bottom you need to have like a plastic liner, okay, because you don't want anything falling, on the floor. And also, you see, this is a supply card for an ortho. They do a lot of ortho cases in the surgery center, and also they do a lot of podiatric cases. Okay, linen, very important. Linen are stored appropriately and covered. The linen are laundry according to the infection control policy. Curtain cleaning is performed regularly. Also, we have antimicrobial protected curtains. That's the latest and greatest. But if the curtain is soiled, it needs to be changed. So this is, for instance, this is in front of the endo room that they use these gowns, the yellow gowns for the endo procedures. It's a clean procedure. And also you can see the linen is inside these linen cards, and they need to be always closed when not in use. If they are going to remove a towel or, a sheet, they need to take it out and then close it and keep it closed at all times. Medication management. Medication must be separated by type and dosage and stored appropriately. Requirements for storage and use of state supplies vaccines are met. The open irrigation solutions are labeled with date and time. If this is when they are, in the OR suite. Medications are within date. Medications require special care after initial use are stored, labeled appropriately, and medications are prepared safely. This is a picture. This is a Pixies card that they use also. And here they have all the medications that they are going to need. Anesthesia is always in charge of the medication, and the RN that is in charge of the case. Here you can see this is difficult intubation or malignant hyperthermia. It's a condition that happens that when they start the anesthesia, the patient can develop a very fast increase in temperature, and that is a high risk event. The patient can die if it's not treated properly. So that's why they always have a malignant hyperthermia card, and also they have a difficult intubation card as well. And they always have, the defibrillator, and everything has to be in order. So charts and medications are disposed in a safe manner, same as any other area. Isolation, even though we are not supposed, this is a surgery center, ambulatory surgery centers, we have patients that test positive for MRSA, and those patients are going to be treated like they're wearing contact isolation. So the staff needs to know if they have a patient that have that circumstances. Patients that have MRSA, they are going to go to a procedure. They are not going to wait, they are not going to do any kind of special treatment for the patient in order to get rid of MRSA. They are going to have the surgery. So if they know in advance that the patient has MRSA, perfect. If not, every patient is going to have a nasal decontamination previous to surgery. So in continuing with isolation, staff are able to articulate isolation policies. Staff are able to say how patients who have no resistant organisms will be managed, and personal protective equipment should be available as well. In the reprocessing of critical equipment, we are going to talk about sterilization of reusable instruments and devices. Reusable medical devices are designed and labeled for multiple uses and are reprocessed by thorough cleaning followed by high-level disinfection or sterilization between patients. It depends what kind of material it is and the procedure that they are doing. They are made of materials that can withstand repeated reprocessing, including manual brushing and the use of chemicals. It's not considered reusable medical devices until the manufacturer provides instructions for reprocessing between patients. So the FDA, the Food and Drug Administration, requires that the manufacturer of reusable medical devices to provide reprocessing instructions that ensure that the device can be used safely and for the purpose for which it's intended. The manufacturer is responsible for providing adequate instructions that are user-friendly and proven to work. However, this point is very important because the healthcare facilities are responsible for cleaning, sterilizing, or disinfecting these devices. So the infection prevention specialist, the infection prevention nurse, needs to know all the policies regarding the reprocessing of medical devices. In cleaning and disinfecting reusable medical devices, compliance with evidence-based guidelines or best practice is the law. We have to reduce the risk of healthcare-associated infections with medical equipment, device, and supplies, and also either we use high-level disinfection and sterilization. I am not going to cover a lot of information regarding high-level disinfection. However, I'm going to talk more about sterilization because my friend Tiffany, she already covered high-level disinfection. So when we talk about sterilization, we need to talk about Spaulding. More than 30 years ago, L.H. Spaulding devised a rational approach to disinfection and sterilization of patient care items and equipment. And this noble person said and believed that the nature of disinfection could be understood readily if instruments and items for patient care were categorized as critical, semi-critical, and non-critical according to the degree of risk for infection involved in the use of these items. So it's very important for us to recognize what is a critical device, what is a semi-critical, or what is a non-critical, according to the risk for infection. And this table is very simple, and I like it because in one column you can see patient contact, the examples, the device classification, and the minimum inactivation level. So when we have in the skin, we know that, stethoscopes, sphygmomanometers, these are non-critical because the skin is completely fine, doesn't have any opening, and there's no contact with blood or any fluid. So that device is classified as non-critical. And then the inactivation level for microorganisms, we have to clean it, or low or intermediate level disinfection. You can use a wipe, you can use a sunny wipe, or you can use whatever product you have in your facility that is in your guidelines. But when we have mucous membranes or non-intestine, well, we use, for instance, the endoscopes or the speculum that they use to use, any kind of vaginal procedure. Those devices are, considered semi-critical, and you need high-level disinfection. So in the speculums now we have disposables, but if they are not disposables, they can use either high-level disinfection or they can sterilize the item as well. If they are going to enter any sterile area of the body, including having blood contact, then that is classified as critical, and that needs sterilization. This table is very, very simple, and I like it because it gives you a lot of information in one simple slide. So disinfection and sterilization are essential for ensuring that medical and surgical instruments do not transmit any infectious pathogens to patients. But, and I said, because sterilization of all patient care items is not necessary. You don't have to sterilize everything, just the ones that are critical, semi-critical, if you can do it. Then the policies must identify primarily on the basis of the items intended for use. So whether cleaning, disinfection, or sterilization is indicated. So the Ambulatory Surgical Center Infection Prevention has developed and implemented policies and procedures for sterilization of reusable instruments and devices that ensure an environment minimizing risk for spread of infection and maximizing prevention of infections and communicable disease. Quite frankly, we need to have the guidelines, and we need to follow either the SOPs or the guidelines for the ambulatory surgery centers the same way we are following in the hospital. The guidelines are exactly the same and does not change. So this is this picture. You can see that they are cleaning devices. Once the patient is inside the OR, the process finished, and that tray is needs to be reprocessed. So as you can see in the picture, the employee is wearing PPE, personal protective equipment. It's covering, their is covering their body with this impermeable, this is a plastic gown that they use. They have long sleeve gloves. They are covering their eyes, okay? And they are using enzymatic detergents to try to eat that protein that is attached to the instrument, okay? And the other picture is showing that if the instrument has hinges, that needs to be open, and they need to use a brush to remove any kind of debris, blood, or any material that was left during surgery. So items are thoroughly pre-cleaned according to the manufacturer instructions and visually inspected for residual soil prior to sterilization. Remember, the sterilization has their capability, but if the instrument is dirty, it's not going to be sterilized. It cannot be considered sterilized. So for instruments that have lumens, that have little, passages, pre-cleaning must include all device channels and lumens with cleaning brushes appropriate for size of instrument, channel, or port. So also in the reprocessing of critical equipment, we use enzymatic cleaners, and those enzymes are digesting whatever is left in that instrument. And this detergent is used and discarded according to the manufacturer instructions. Also, cleaning brushes are disposable or clean, high-level disinfected or sterilized per manufacturer instructions after each use. Always remember that you have to follow your manufacturer instructions every time. So these are most frequently cited. So when we have the accrediting organizations like our ACA, CMS, or Joint Commission, DMV, they have done this process before, and these are findings during the process. These are findings that need to be addressed. These are one of the most common findings, which are endoscope was not clean or high-level disinfected in accordance to the manufacturer instructions. All steps were not followed, no leak testing or inadequate rinse. Incorrect products used for cleaning, for instance, wrong size brush. High-level temperature or concentration is not monitored. Bronchoscopes were stored inside carrying cases or the shipping case, that is not cleanable. So these are the findings that they have found in the endoscopy area. And remember always to follow the manufacturer recommendations. For a product to be out in the market, they need to go to a very rigorous process through FDA or any accrediting agency, and that's why we need to follow what they said to us, because they have been proved and that has been approved by the accrediting agency. And it's very important. If we don't follow that, we are compromising patient safety. So also there's facilities that they reprocess items that says one-time use only, but they are doing that. For instance, there is a company that is called Advantage Reprocessing Recollection Program, and those are devices that are going to be reprocessed at least one or two, and that process is being done in a FDA regulation by an FDA regulated company. So it's very rigorous, all the process that they need to go through in order to certify that the items that they are reprocessing is in good standard to be used in a human again. So, question. I know Luz told me that you guys love questions. So why is so important to follow the instrument reprocessing guidelines? A, to ensure that the equipment does not transmit infectious pathogens to patients. B, to avoid being cited by the government. C, to prolong the life of the equipment instrument. D, to avoid cross-contamination between cases. Luz, are you available?
Yeah, I'm here.
Okay, so can you ask the question?
Yeah. If you want me to repeat it, I can. So the question is, why is it so important to follow the instrument reprocessing guidelines? A is to ensure that the equipment does not transmit infectious pathogens to patients. B, to avoid being cited by the government. C, to prolong the life of the equipment or instrument. D, to avoid cross-contamination between cases. And E is all of the above. So go ahead and put those answers in, everybody. There's quite a few of you on the line, so I want to see lots of answers in here. Okay, so the general consensus right now is E. So we're getting a lot of E's. Actually,
Yes.
E is the only answer we're getting.
Oh, perfect. Yes, that's true. Everything that is on that slide is true. It's absolutely. You have, when I say to prolong the life of the equipment they need to go to a process before it's re-sterilized again. That includes, cleaning those channels, lubrication in order to keep, those hinges working properly. Okay, so yeah, it's E. Thank you. Very good. Excellent. So let's look about the process that is going through. Once the instruments are in the area that is going to be reprocessed, now we have what is called a washer disinfector. Let me tell you, before, many moons ago, you have two hands, and that is your washer disinfector. Before, we used to do everything manually. Now they do manually pre-cleaning, and then everything goes into the washer disinfector. And then after pre-cleaning, all the instruments are appropriately placed inside the washer disinfector, and the hinges instruments are open and the instruments are disassembled if indicated by the manufacturer. And that's one of the problems, is that if the staff doesn't know that equipment needs to be disassembled, that equipment can have blood or any kind of fluid inside, and then they go through the whole process of sterilization, and it could happen that you can have, an emergency situation in the OR when the doctor tries to use the equipment and the equipment doesn't work, and it's because it was not treated properly during the process of pre-cleaning and reprocessing and sterilization. So we need to avoid that. Everything that have hinges needs to be open. Anything that have, different pieces needs to be separate, needs to be cleaned and reassembled again after they go through the washer disinfection. So the instrument tray assembly, the sterilization of reusable instruments and devices is accomplished in a manner consistent with the hospital infection control policies or the ambulatory surgery center policy and procedures to maximize the prevention of infection and communicable disease. That's for the Center of CMS, Medicare, Medicaid, 2018. They are going to, once that tray comes from the washer disinfector, needs to be assembled again in the same way every time. And this is an example of a tray that is ready to go into the sterilizer. We run quality control for all the trays and all the instruments that goes inside a sterilizer. We have what is called chemical indicators, physical indicators, and biological indicators. Okay? So chemical indicators are designed to indicate to a visible color change when the device has been exposed to the sterilization process. So for instance, we have steam that change from white to black. And as an example, if you see this tape that is here, this is the steam, because it's white, those stripes are white, and then when it goes through the sterilizer and they apply heat, it's going to change to black. Ethylene oxide is another type of sterilization that I don't know how many of you use ethylene oxide, but it changed from orange to red, and hydrogen peroxide changed from red to yellow. I am going to give you the example of all those, type of sterilization in a brief moment. A chemical indicator is placed in the instrument pack or tray at every load. Okay, so they have like a display of all the chemical indicators that they have, and also here you see one in the picture in the center says STERRAD. STERRAD is a gas plasma sterilizer that uses hydrogen peroxide. The second tape that you see besides the STERRAD, that one is for the steam sterilizer, and then you can see that they also have an indicator strip and indicator tape. Also, the one that is steam has an indicator strip as well. So this is the STERRAD system. This is a gas plasma, hydrogen peroxide gas plasma sterilizer that use hydrogen peroxide 55%. And the indicators are related to the traffic light. For instance, when you see a package that has this red tape, means that red means stop, it's not sterilized. Same happens with the strip, and it's going to change to this yellow color, means continue with caution. They don't have a green light, but they use those two, the red and the yellow. Also, we have process indicators that are telling us that that sterilizer, that the tray that is inside the sterilizer, or the packages that they place inside the sterilizer, have been through a process of time, temperature, and pressure. Okay, think of the sterilizer as a huge cooking plate. We are going to cook the instrument, but before we cook, we need to take the air out of the chamber. The chamber is closed, the air is pulled, and then they are going to what? They are going to apply steam, very, very hot steam that are going to penetrate those the drapes, and they are going to penetrate also what? The pouches, and what they are going to do is they are going to kill whatever remains after the washer, disinfector, and the whole process of pre-cleaning and wash is going to die, because the temperature is at 275 degrees, and it's going to be for an X amount of time, ensuring that whatever was still maybe there is going to be completely sterile. So here we have a receipt of the process that is telling me that the machine doesn't have any malfunction, that the pressure was correct, the time was correct. Okay. So, and then we add another test, what is called the Bobby Deep test, that is going to measure what? It's going to measure how well that sterilizer removes the air from the chamber, and the penetration of the steam was properly made. And that's why this is the one from 3M, the one that you see in the center. That this is like a package, like a little cube. And then when you open that, once the process finishes, you open it, and then this is what you are going to find. Okay. So, and this, you have to see that every single line has to be completely black. That's telling me that the air was taken out from the chamber in a proper manner, and that the steam that was utilized in that steam sterilizer penetrates correctly all the pouches and all the trays that were inside. Also, we are going to talk about the other way of the quality control, which are the biological indicators that are run with the first lobe of every day at a minimum, and more often if the sterilizer manufacturer indicates a more frequent process. Each type of sterilizer has their own spore testing. These are live spores. These are microorganisms. Spores are one of the most difficult items to kill, So that's why we are using spores to verify that the process inside that chamber was done properly and nothing is alive. So a biological indicator is also placed on every load if an implant is being sterilized. So here, for instance, you can see a picture that said implant. That means that tray has an implant inside that is going to be used in a patient, and we need to guarantee that everything inside that tray is completely sterile, because that implant is going to stay with the patient forever. Okay. So, and this is the incubator that we use. They have that spore goes in a little package. Once the process finishes, and they have passed the strips, the chemical indicators, the process indicator, which is the strip, then we have to see the biological indicators. The three of them need to be in accordance. These two work, together in order to verify, in order to validate that load is ready to use in humans. That spore is going to be incubated for 1 hour, and after the hour, if all the process is complete, we are fine. We have the green light to release that tray to be used in humans.
Hey, Luz.
Yes, ma'am.
This is the other Luz. I just want to go back on this slide. So when it comes to biological indicators, if you're an IP at a facility and you want to conduct an audit on whether these biological indicators are being done, from your experience, are these basically documented electronically, or is it
Yes.
more common to find these in a binder, or like what's your experience with the documentation?
I am going to show you, that is a great question, Luz. I'm going to show you a process that is following now. In the past, we used to do everything was manually done. However, now we have a system that is completely automated, and I'm going to show you a picture of that. So I'm going to keep going, but I am going to answer your question.
Okay, thank you.
Yes, and that and now you can see it. We have a database, and that database has the sterilization log. It's accurate and up to date. If you see the computer, you see the screen, and also you see this. This is like a barcode
Scanner.
reader. That scanner. They are going to scan every load that enters the autoclave. They scan that load, and then when that is out, they scan the receipt, and also they scan the spore. And it's a very, very systematic process. Yes, if you want to do an audit, everything has to be precise. Everything has to be 1, 2, 3, 4. There's no working around. Oh no, they have binders. They keep the information in case they have a system malfunction. Yes, they keep that, and also they have an automatic process for following all the spore testing. Because if that spore came back positive, they have a way to recall any kind of item that was done in that load. Okay, and they follow what is called the perpetual calendar. So each day of the year has a number. In the past, we used to follow the perpetual calendar, and I'm gonna show you a picture. So, and in that picture, you're gonna see a sticker, and that sticker of that film that is attached to the tray is a way also to do quality control, because if they need to look for that item specific, they know where they are going to look. In the past, we don't have that kind of technology. So in review, a chemical indicator is a process indicator. It's placed correctly in the instrument packs in every load. Stereo packs are labeled with the sterilizer use, the cycle or load number, and the day of sterilization. That answer one of your questions. The loads for each sterilizer cycle are current and include results from each load, and the routine maintenance for sterilization equipment is performed according to the manufacturer instructions. So, question. Luz, do you want to do that question?
Yeah, I can do it, Luz. Don't worry. So question. When a load or tray can be released to be safely used on a surgical case. So when can a load or tray be released to be safely used on a surgical case? A, when all the quality control parameters are complete and in good standing. B, when the spores are negative. C, when the chemical indicators change color. D, when the time, pressure, and temperature receipt of the sterilizer is released. I'm going to give you guys a couple of seconds here. Make sure you're putting in your answers. Okay, so we have a lot of A's.
Okay.
Some C's, some B's. But
Okay.
the majority of them are all A's.
If you mark B when spores are negative, that's 1 point only. When the chemical indicator change color, that's just 1 point. When the time, pressure, and temperature receipt of the sterilizer is released, that's another point. But if you want to have the 3 points for quality, when all the quality control parameters are complete and in good standing, so it's A. Thank you. Let's continue.
You're welcome.
So the sterilization process. Then what happened with that tray? It's sterile. We need to save it. So after sterilization, devices and instruments are stored in a designated place, clean area, so sterility and cleanliness is not compromised, and they are following the room temperature and also the humidity. The surgery center has policies and procedures and documentation that sterile packages are inspected for integrity and compromised packages are reprocessed prior to use. Policies and procedures are in place outlining facility response, for instance, if they have a recall of a device, and risk assessment. And in the event of a reprocessing error or failure, that could result in the transmission of infectious disease. And if you see that picture, that is a tray that they use, this kind of aluminum tray. They have this tag here, and that tag gives you all the information regarding the tray and also has a barcode. So if they read that barcode, it's going to have the manifest regarding whatever they have inside that tray, when the sport was done, and if all the parameters for the sterilization was done properly. So, and then you see this is the picture of all, we have pouches and we have other supplies in the surgery center. So everything has to be, very well organized in order to expedite the process when they are going to prepare a case. And meaning that prepare those cards, they have a card, they open that card, and then they start taking, all the supplies that they need according to the doctor's preference. And same happens here with all the supplies as well. So another question.
Okay,
Ruth,
so
be my guest.
what are the most frequent findings in the instrument processing area? A, instruments were not cleaned and sterilized in accordance with manufacturer instructions. B, time, temperature, or pressure is not monitored. C, instrument not disassembled during terminal cleaning or sterilization. And D, all of the above.
That was a bonus question. That was very easy. I think they know the answer already.
Yeah, it seems like they're really getting this one. I think
yes.
I think the shading might have given it away a little bit.
Yes.
So everybody's putting D. The majority is almost everybody's putting D.
Yeah, exactly. Because these are the most frequently findings in the instrument processing area. So what I want to do with this slide is to let you know that when you are doing your surveillance, your infection prevention surveillance, and when you are learning about OR and surgical practices, these are the areas that you need to pinpoint because these are the areas with the vast majority of findings, and just as a matter of education. The sterilization process. This is the review. Proper personal protective equipment is worn when processing dirty equipment. Competencies are maintained for cleaning, disinfection, and sterilization process. The contamination and sterilization is performed in an appropriate environment. The areas used for cleaning or disinfection flows from dirty to clean, and sterile packages are inspected for integrity, and compromised packages are reprocessed. So examples of observations found. This comes from the Joint Commission. Dirty items and clean items are stored together, which is a big no-no. Vaginal ultrasounds not protected from contamination after storage. Storage rack without a bottom shelf, and fire items. So take a moment, go to the surgery center, and check everything like you are in the OR. Remember, it's the same patient. So I am going to, last but not least, I'm going to talk about the advantage and disadvantage of commonly used sterilization technology, because we need to know what kind of sterilization system you are using in your surgical center. Okay, so and this is a picture of the three of the ones that are using the most. We have the steam, the hydrogen peroxide, and the peracetic acid. The steam autoclave is very good. It's non-toxic to patients. It's that with what we have since for ages. The cycle is easy to control and monitor. It's very rapidly microbicidal. It's the least affected by organic or inorganic soils among sterilization process. The cycle time is very fast and penetrates medical packing and device lumen. What are the disadvantages? Heat-sensitive instruments cannot be processed in a steam sterilizer because you are going to melt those devices. Microsurgical instruments are damaged by repeated exposure and may leave instrument wet, causing them to rot. And if you know that if the item is wet when it comes from the sterilizer, means that the sterilizer needs to be shut down and see what is happening, and those instruments cannot be used. And also, since this is steamed, it's 275 degrees, is the potential for burns is very high, and believe me, it's a very bad burn. The hydrogen peroxide gas plasma is safe for the environment, leaves no toxic residual. The cycle time can go from 25 to 75 minutes. It's used for heat and moisture sensitive items since process temperature below 50 degrees Celsius. It's very simple to operate. Just the only thing that you need is an outlet, an electrical outlet, and it's compatible with most medical devices and only requires an electrical outlet. In times of war that they have electrical outlet and they can, the installations of steam sterilizer, it's a whole process. It's going to stay there forever, cannot be moved. But this sterilizer, the only thing that you need is to, connect to an electrical outlet and you are done. You can use it anywhere. What are the disadvantages? Cellulose or paper wrap cannot be used. No linen or liquids can be processed. The sterilization chamber is small, so you can run a lot of instruments, or you cannot have a big load there. Some endoscopes or medical devices with long or narrow lumens cannot be processed. In the United States, in Europe, yes, they have what is called a booster that have hydrogen peroxide, and in one of the cycles liberate the hydrogen peroxide to the lumen, but that has not been approved yet in the United States. And requires synthetic packaging with polypropylene wrap or polyolefin pouches. And also needs a special container tray. And hydrogen peroxide may be toxic and level greater than 1 part per million. In the peracetic acid or the STERRAD system, it's a very rapid cycle as well. It's low temperature. It's a liquid immersion sterilization. It's environmental friendly, and also the sterilant flows through the endoscope, which facilitates salt and protein and microbe removal. However, one of the disadvantages is that if a point of use item, you immediately use it, whatever you remove from that, the scope that you remove from that system needs to be used immediately. You cannot save that. So, and it's also used for immersible instruments only. Some materials are incompatible. For instance, aluminum anoxide coatings became dull with the peracetic acid. One scope or a small lumen of instrument processed in a cycle, and they have in their caution is potential for serious eye and skin damage. That's why you need to use your personal protective equipment. So, question, Luz, be my guest.
What is the perfect sterilization system? A, steam sterilizer. B, gas plasma of hydrogen peroxide. C, peracetic acid. D, ETO. Or E, none of the above. The perfect sterilization system does not exist. Or in like Mean Girls, limit does not exist. So what is your answer?
This is a hard one.
Okay, so the majority of the crew is putting E.
Okay, yes, it's E. You know why? Because there is no perfect sterilization system. We have steam for heat instruments that can withstand heat. We have gas plasma or hydrogen peroxide or peracetic acid for delicate instruments for temperature less than 50 degrees. I put ETO. ETO is ethylene oxide, is a gas, but it's no longer used because of the carcinogenic, and it's exactly the same. However, ETO lasts like 8 hours to run a load. So the answer absolutely is E. None of the above. The perfect sterilization system does not exist. So we have to use a combination. And that's why, we have a variety of process going on in the surgical center, and we need to know each one of them. We need to know that each one of them has their specific guidelines, and we need to know all of them, okay? I'm not putting pressure, but this is the way that we need to work with this kind of process in the surgical center, okay? So the surgical center, some of them are divided. They have different procedural areas. Their appropriate surgical attire is utilized in designated spaces. They say, well, this is a surgery center and the doctor can enter in street clothes. No, you are going to do a surgical process on a patient. You need to follow the guidelines for the proper attire in the designated space. There are sometimes what they do is that they put, for instance, they have an endoscopy suite only, or they have a bronchoscopy suite only, and then they have another suite for general surgery. It depends what are the procedures that can be done in that surgery center. Depends what kind of surgeons you have in that area. For instance, if you have hand surgeons, if you have podiatrists, if you have gynecologists, if you have gastroenterologists or pulmonologists, they are going to do different procedures. And what they are doing, it's working very well. If you have, for instance, 3 suites, is to stratify where it's going to be this procedure done, this other procedure done, and then they block that room for specific procedures only, which is good because then they know what kind of process of cleaning they are going to do for each suite. Okay. So in procedural areas, also the procedure rooms are cleaned and disinfected after each surgical case or invasive procedure with an EPA registered disinfectant. We follow an SPD contamination, the contamination cleaning law that is followed by the EDS department of the cleaning department. Okay, so very, very important. Well, I think that we have a very good time. In conclusion, always follow the infection prevention best practices. Follow your institution guidelines. Do not take shortcuts. Never take shortcuts. Remember, do not harm. And teamwork, that's the key. You are part of a team of surgical nurses, anesthesiologists, surgeons, and you need to show them that you know what you are doing, that you know everything related to the OR. I know that is going to take time. I am an OR nurse. I work in the OR for many, many years, and I feel privileged that I can master this information. But this takes time. Don't feel afraid. Go to your surgical center, know your staff, know the people that work there, and always, very polite, check their guidelines, check, the cleaning log, the spore testing, the chemical indicators log, every single log that they have, everything. They have all the information. So you go ahead, make friends with your surgical center personnel. They are very nice. They are like a big family within a family. Okay. So now I'm going to open for questions.
Wow, Luz, thank you so much. That was very helpful. I really appreciate you coming on this wonderful Friday. So I'm just going to give everybody a couple of seconds to see if they have any questions for you. And while we wait, I'll just go ahead and ask you a question that I have. So I come from a background in public health, and I know that we have quite a few epidemiologists on the line or people who are working in public health who do not have a clinical background. And I can definitely attest to the fact that it's intimidating to go into the ORs when you don't have that clinical experience. So for those of us whose work experience and education has been primarily in the field of public health, what advice do you have for becoming more comfortable with operating rooms?
That is an excellent question, Luz. You know what? We have companies, like for instance, 3M, we have Combatec, we have a lot of companies that have websites that have education. That education is free. So you can go to their website and then you can go and register and you can download all the education regarding OR. For instance, 3M is very good with the OR education. And also each department or for instance, OR surgical center, they have an educator and they have a person that is the expert. You can ask them if you can shadow cases. and if she can give you more information about the cases, if she can tell you what is the day, the day process for the OR and the surgical center, which is the same, and they can help you. And there is an association which is called American Association of Operating Room Nurses, and you can be a member. You don't need to be a member at large, but you can be a member, and they allow you to have a huge collection of information, books, articles regarding OR, and they have training as well. And there is a lot of resources out there. I can do a compilation of resources, free resources, and also Medline, that is another company. It's a huge company that they have information for education. Infection control today also is free education. So don't feel afraid to ask. I know you don't, but there is a lot of education, and also you can participate of the ARN meetings. You can participate of the ARN convention. Also, there is another association, which is the supply chain, the SPD Association, and that is an association that is worldwide as well, that you can be a member, and they give you books for free. And it's amazing how many sources of information and education we have through their website and through the internet. So, and if any of you feel comfortable, they can join me. We can do an OR rounding, which is very good and very interesting.
So that's definitely that's a great offer for those of you who are anywhere near Apopka, because Luz is absolutely great to learn from. She's wonderful. So we have had a couple questions come in. For those of you who need to leave, please feel free. We'll have all of this recorded so you can listen to the questions at a later time. So for the first question, it comes from Linda. She says, for the non-OR nurses, can you briefly discuss the different air pressure relationships between the general operating room, endoscopy, and bronchoscopy suites?
That is a very good question, and I was thinking about that someone was going to do that question to me. Okay, so when we have a bronchoscopy unit, we are doing cases that are, it could be rural TB or TB cases. The pressure inside that room is called negative pressure. Okay, in the regular OR is neutral. Okay, that's the air exchange is going to be neutral, and in the OR it's called in the different areas. In the regular area is going to be positive pressure. Okay, but it's very important to know that the OR suite is neutral, and the pressure inside the bronchoscopy suite is negative pressure, because you don't want anything that is inside that suite go outside to the corridor. That's why you use that. The other area that she asked me, I can recall, which you say three of them.
Oh, it was endoscopy, Luz.
Oh, endoscopy. Yeah, endoscopy. Endoscopy is positive pressure.
Okay, our next question is, can you explain ETO sterilization?
Well, ETO sterilization, they use ethylene oxide, which is a gas. They have an ampule that they use ampules of ETO, okay, that are released. First, they take all the air out of the chamber. The ETO chamber is big. Why? Because it's a process that lasts for hours. But it's kind of banned now from the process, because they have carcinogenic properties, meaning that if the person, they have certain limits of exposure, and the employees need to wear what is called a dosimeter, an ETO dosimeter, and then that needs to be sent to register. If they have certain amounts over the threshold, the employee needs to be removed. But going back to the process of ETO, they have what is like a capsule, and when they remove all the air from the chamber, that those capsules of ethylene oxide are released and then that penetrates those items or the packages or the trays that they are going to be sterilized with ETO. ETO is used, it's low temperature as well as STERRAD and peracetic acid. But then ETO is that gas is gonna go into that, and then it's going to. That is when the sterilization process is going to be taken care of. But that after that's finished, those packages needs to be aerated. That's why that takes so long. It's going to be aerated inside the chamber. So that everything, those toxics that is they're using with EPO, that needs to be removed in order to be safe to be used on patients. That's what is EPO. EPO is it has a boom 60s, 60s, 70s, 80s, but then after they knew that it's carcinogenic and they can cause abortions in females employees, then it has been banned little by little. And right now, there's a lot of hospitals that doesn't have ethylene oxide anymore.
Okay, our next question is from Scott Arden. He said, Luz, may we contact you regarding an upgrade we are planning for our SPD?
Yeah, I'm gonna. This is my contact information. That's my email. Absolutely, you can email me, and absolutely, I can help you.
Okay, the next question is by Christy Walker. Is there a special process that needs to be followed or testing that needs to be completed if a sterilizer or washer is down for repair or the washer is down for repair prior to using it again?
Yes, that's a very, very good question, and that is a question that CMS or Joint Commission DMV is going to ask you. If you have a sterilizer that failed, for instance, to change the biological indicator, failed to change the strips or the chemical strips, or failed any of the process, that needs to be placed down. You need to call the biomed. The biomed needs to do a revision, do a run test on that sterilizer. If the sterilizer needs to be fixed, it's going to be placed down, and you need to run 3 cycles, okay? 3 cycles that have to be negative in order to put that sterilizer to work again. However, that's the standard, but you need to follow the policies and procedures from your hospital or surgery center before anything. Whatever is in the policy, which I think is going to be exactly the same, because those are the AMI standards, that you need to run 3 cycles, and once those 3 cycles did not fail, they are completely correct. All the process is, you have the green light to use that sterilizer again. But you need to call biomed, and also if they have any work done inside the chamber, that the same place that they are going to put the tray, that needs to be cleaned before anything.
Okay, everybody. Unfortunately, we do need to get off the line. I will send any additional questions to Luz. We have another webinar that'll need to be taking place. So thank you so much, everybody. Thank you so much, Luz, and I hope you guys all have a great weekend. Goodbye.
Thank you.
Bye.